Hi, my name is Ron, and I'm a peritoneal cycler patient. I connect every night for 8 hours and disconnect in the morning, and then I'm allowed then to live fairly free for the rest of the day. And the dialysis happens while I'm sleeping, so that's pretty beneficial. It allows me to carry on about as close to my normal life, I guess you could say. So I travel with the students on field trips and so on and so forth, and as long as I have, a private hotel room, no one even has an idea that I'm going through this. I think that I'm able to continue on as normal as I possibly could. It comes with trade-offs, but then I think it's well worth it considering the other options.
My name is Annette. I have been a dialysis patient I'm in my 12th year, and now I am a home hemo patient doing nocturnal, and I've been doing that now for almost 2 years. Being a home dialysis patient allowed me to be independent, self-sufficient, give me a little bit of normalcy in my life. I'm able to work it into my schedule rather it working me into its schedule or a hospital schedule. Being at home gives us the opportunity to be more spontaneous in our relationship. Being at home, having more energy makes you have more, a better self-worth, and with self-worth comes, a better sex life, a better sexuality.
My name is Frank. I've been on dialysis for almost 9 years. My wife and I traveled a fair bit before dialysis, and certainly we wanted to continue traveling as much as possible. So when we looked at the options for dialysis in the time period before I started dialysis, we learned that peritoneal would obviously allow us a lot more flexibility to go where we want, or to go at least more than we would be if we were on hemodialysis. And that was a major factor in our selecting to go on home dialysis in the first place. Peritoneal dialysis is certainly not a picnic. It is a major change in your lifestyle. It's demanding. You have to do it every day. It doesn't matter if you're sick and tired and don't feel like doing it, you have to do it. On the other hand, it gives you life.
My name's Tanya. I've been on dialysis for a total of almost 16 years now. The last 4 have been on home hemodialysis. I enjoy being on home dialysis a lot more than being at the hospital. I have more control over going out with my friends. I can go out to coffee with my friends now. I go out to lunch with my friends or dinner. Because my schedule is much more flexible, I'm able to do that. I enjoy walking a lot, so I can go for my walks at any time during the day. I don't have to think about, oh, I have to go to dialysis today. It takes a lot of discipline to do it at home because it's very easy to say, I'm not going to do it today. So it does take a lot of discipline for that. That's true. I just like the comfort of being able to be at home. I can do what I want. I can either watch TV while I'm on dialysis, or I can read my book while I'm on dialysis. I go on my internet while I'm on dialysis. There was a lot of benefits that I couldn't do that at the hospital.
So for those of you who have viewed this video, I hope you've seen evidence of the benefits and feasibility of home dialysis, and we would encourage you to consider this as a viable choice. All of us involved in dialysis are readily available to answer any questions and to support you both during your training and once you are launched home You do not lose the connection with our program. You continue to be reviewed by your nephrologist and followed carefully by the entire team.